to my channel. Today my topic is respiratory disorders. There are a number of respiratory disorders which affect people. The percentage of such disorders is practically high in Pakistan. It is due to the more concentration of air pollutants not only in the urban but also in the rural atmosphere. Some of the important respiratory disorders are described next. Bronchitis is the inflammation of bronchi or bronchioles. It results in excessive secretion of mucus into the tubes, leading the swelling of tubular walls and narrowing of tubes. It is caused by viruses, bacteria, or exposure to chemical irritant. For example, tobacco smoke. There are two major types of bronchitis, acute and chronic. The acute bronchitis usually lasts about 2 weeks and patient recovered with no permanent damage to the bronchi or bronchioles. In chronic bronchitis, the bronchi develop chronic inflammation. It usually lasts for the 3 months to 2 years. Symptoms of bronchitis include cough, mild, wheezing, fever, chills, and shortness of breath. Emphysema is the destruction of the wall of the alveoli. It results in larger sacs but with less surface area for gaseous exchange. As lung tissue breakdowns, the lungs do not come back to their original shape after exhalation. So air cannot be pushed out and it is trapped in the lungs. The symptoms of emphysema include shortness of breath, fatigue, recurrent respiratory infections, and weight loss. By the time the symptoms of emphysema appear, the patient has usually lost 50% to 70% of his/her lung tissues. The level of oxygen in blood may get so low that it causes serious complication. Pneumonia is an infection of lungs. If this infection affects both lungs, then is called double pneumonia. The most common cause of pneumonia is bacterium, Spectrococcus pneumonia. Some viral influenza virus and fungal infections may also lead to pneumonia. When the causative organisms enter the alveoli, they settle here and grow in number. They break the lung tissues and the area becomes filled with fluid and pus. The symptoms of pneumonia include a cold that is followed by high fever, shivering, and a cough with septum production. Patient may become short of breath. The patient's skin colors may change and become dusky or purplish. It is due to poor oxygenation of blood. Vaccines are available to prevent pneumonia caused by S. pneumonia. Antibiotics are used in the treatment of this type of pneumonia. Asthma is a form of allergy in which there is inflammation of the bronchi, more mucus production, and narrowing of the airways. In asthma patient, the bronchi and bronchioles become sensitive at different allergens. Dust, smoke, perfumes, pollens. With exposed to any of such allergens, the sensitive airways show immediate and excessive response of constriction. In this condition, the patient feels difficulty in breathing. The symptoms of asthma vary from person to person. The major symptoms include a shortness of breath, especially with exertion or at night, wheezing, whistling sound, and when breathing out, coughs and chest tightness. The chemical with ability to dilate the bronchi and bronchioles are used in the treatment of asthma. Such medicines is given in the form of inhalants. Lungs cancer is a disease of uncontrolled cell division. In the tissues of the lung, the cells continues to divide without any control and form tumors. The cellular growth may also invade adjacent tissues behind the lungs. The most common symptoms are shortness of breath, coughing, including coughing up blood, and weight loss. The main causes of any cancer include carcinogens such as cigarette smoke, ionizing radiation, and viral infection. Smoking is the main cause of lung cancer. This risk of lung cancer is significantly lower in non smokers. Cigarette smoke